Hi there, everybody. Thank you for joining me. I'm Amanda Smith Holistics. Stay with me. The video is going to demonstrate a reflexology routine specifically designed for my lovely client Esther with her menopause issues. So, my perimenopause journey began 3 years ago, and I've had to dig really deep at finding out where that comes from, why, and I've used my holistic tools as much as possible to try and deal with them. And I've actually discovered that there's an emotional root barrier that then manifests as something physical. And so I've been using my holistic tips and tricks to unfold and journal and release that I've been holding on to. And it's been an interesting journey. I've enjoyed sharing it with you on these videos, and hopefully you will get a lot from it as well. As always with these videos, if you can like and subscribe and comment, it really, really helps. But for now, enjoy the reflexology treatment on Esther. So to begin a reflexology treatment, we apply oil to the feet. You can use a foot cream, which can be really nourishing to dry skin. And we're using something called effleurage strokes, which are strokes that start, finish, or link movements together. We're introducing the touch of us to the touch of the client, joining our energies and just warming up the foot, ready to receive the treatment. I want to make sure that each of the toes has got a good amount of oil and that the toes are relaxed and that the foot is relaxed. And I can lift the foot with one hand and then slide the other hand up and under the heel, and then swap hands, and then the whole foot and the heel has been covered. We always tend to work on the client's right foot first, which is the left for us as we look at it. Just energetically and emotionally, that's always the preference. And then depending on the room temperature, it might be that we cover the foot that we're not working on, so the client can stay nice and cosy and warm. It's always nice to check the positioning of the client. She might want something under her knees to help her back, or she might want the back of the bed lifted slightly. And then we begin the actual reflexology, and I always support the part I'm working on so it doesn't wobble, and this is called thumb walking. And we thumb walk the big toe first, and this is the brain, the head, the pituitary. So from a menopausal point of view, the pituitary is the big motherboard that controls all the other hormonal systems in the body. So we need to make sure this one is working, balanced, functioning as it was designed to do. So I like to give this lots of love to really help balance it. And then we thumb walk the base of the big toe, and this is the neck. I like to do that a couple of times, and right round into here, this is the occipital ridge, which is where the skull joins the neck, sort of where the hairline begins at the back of the neck. And often in there there's a lot of crunching, just because naturally, posturally, we're quite lazy human beings. And then we finger walk round the front, and that's the throat. And then we move on to the next toe. There's a little bit of brain in each of these toe pads, but the length of the toe tends to be the sinuses. So I'm slowly working, and we always work big toe to little toe. This area is zone 1, zone 2, zones 3, zone 4 and zone 5, and we always start at zone 1 and work our way out to zone 5. And then we finger walk the fronts, and this tends to be the teeth and the jaw. And then thumb walk along the base of the toe joins, back and forth. And then we've got the eye on this side of the body, and the ear. And then I like to just pull all that away, help it shift out through the body. And so that's our first area or grid. And then we're going to work on this area or grid next. And this is called the diaphragm line, and that's called the shoulder line. So we're going to work diaphragm line to shoulder line, starting at zone 1, working up. And this is the thyroid area, and can often feel a bit crunchy. I think with our hormones fluctuating, we can be in flight or fight or freeze, and then often our appetites disappear. So to help balance that thyroid and the metabolism, help that even back out, is always a really good thing. And then we are on to the lungs. And so often we don't take deep breaths, nice full breaths. And again, when we don't breathe full breaths, we don't get the blood flowing around the body, so we don't feed our cells with enough oxygen, and our cell metabolism can suffer. So just to give our lungs a good clear through. And again, encouraging ourselves to take some nice deep breaths is really powerful. And then out here, we are on the shoulder, which for most people is crunchy, because again, posturally, we don't tend to hold ourselves as strongly as we should. And then we go outwards across that area, so this one gets a double do. And we're just flushing it. If you think about the fact that this is the inner body, the spine, and this is the outer body, the shoulder, so the armpit, and we're going to just drain all of that to the lymphatic node in the armpit. So we're really trying to help flush the system through. then we're going to work on the front of the foot. And so the front of the foot is the chest and breast. And again, menopause and hormone imbalances, sometimes you can get breast tenderness, and this just helps to soothe and calm all of those bits. And you can see my other hand supporting so that that foot's not moving around too much. Allows the client to relax a lot more. And then we move down to our neck zone, which is the pelvic line to the waistline. Oh no, we haven't done waistline to diaphragm line first. So we're going to start on the inside at the spine and just work our way up from the waistline to the diaphragm line. And so in here, if you literally think about the torso of the body from the waistline, so where the belly button is, up to the diaphragm, we've got the stomach, the solar plexus. So for me, the solar plexus is all about the emotional centre. You know, when you suddenly think, oh my goodness, I've forgotten whatever. For me, I feel like I've been punched in the stomach, and it's just the solar plexus that responds to that. So to work on the solar plexus and really help to soothe and balance that fight, flight, freeze is really powerful. And then, as I've talked about in other videos, when the solar plexus is working on the fight, flight, freeze with the anxiety, my stomach knots up after it as well. So to really help, we're working on the tummy as well at this point, and it's just very soothing. And this out here is the liver, and often that's working hard because it's being drip fed constant cortisol to try and filter out of our system. So our poor livers are working overtime constantly, so to give that a nice flush and rebalance. Now I'm going to lift the foot slightly. I'm going to work from the pelvis line to the waistline. And so again, if you think about our torsos, but sort of from the groin up to that belly button line, that's the area we're working in. So we've got the colon, the bladder, big intestine, small intestines. And we're just helping to give it all a flush through. And then we're going to do the very bottom, so the pelvis, at the bottom of the heel up to the pelvis line. And so this is lower back, sciatica, hips. And this is where if you haven't put enough cream on that heel, it can get quite dry. And now we're going to work down and then up the spine, which is this inner, we're literally following the curve of the inner foot. So we lead with the thumb and go all the way down. A little bit of crunching there, that's mid. Probably just slightly lower than bra strap line, there's something going on there. Then we go back up. And then we work on the outside, finger walk around the outside of the foot, and we start at the top. So this is the shoulder, having a nice clunk, and we wrap right the way around, so we can go right from the start of zone 5 right the way to the front and the end of zone 5. We come down a smidge, so this is the armpit or the side of the waist. We come down a bit further and we're on the hips. And again, joint pain, hip pain. For me, I've always had a bit of, just as I'm due on, I get a lower back tightness. It feels like it needs to be cracked, and it feels like sometimes my hip might just pop out of joint. And that's just the hormones. When you're due to give birth, everything softens, and sometimes that hormone can be mimicked when you're due on your period. And so that can make your joints feel all funny. And so this helps to just re-stabilise that. We're slowly moving down till we get right to that sciatic area. And then we go on to the kidneys and the bladder area. Most people, myself included, often don't drink enough. And so this can feel a bit funky, where the system's not really fully hydrated. So that's the kidney area. And we're just working, circling gently on that, just to try and encourage it to filter what's there and function as well as it can, even though it's potentially in a bit of a dehydrated state. And then we move that through the urethra towards the bladder. And then we circle the bladder. I always find this so comforting, just circling on my bladder. I've no idea why. I'm not one prone for cystitis or things, but this just sends me off. And then from here we go on to the ovaries. So that's just on the inside of the ankle. Sorry, this one's the womb. We work on the womb first. We roll the foot to the outside, and the exact spot on the other side is the ovaries. And then we finger walk up and over, and these are the fallopian tubes, and they join from one to the other. So they really help the ovaries travel through to the womb. So for fertility, I would spend a lot of time just making sure that pathway is clear so that egg can travel well. And if it was for fertility, I like the man to come and have a treatment as well. And I can then work on his prostate. And these are the vas deferens, so that I can just make sure everything's flowing and smooth to give the chance of new life as much as it can. And then we go on to the other foot. And we repeat that process on the other side. So we start off with the toes. And we thumb walk the big toe, which is the brain, and just help to slow and rebalance, recalibrate the pituitary. The pineal's up here as well, which is the gland responsible for light-induced migraines, seasonal affective disorder. That's a bit crunchy actually. So if it feels a bit crunchy, it could be that there's a migraine inbound, or she's just getting over a migraine, or she just needs a bit more sunlight. do the base of the big toe. And then we finger walk the front of the foot and then onto the other toes. And again, these are the sinuses, or in the very top is the brain, another little brain point. And then we work the fronts. And the fronts are the throat, the jaw, the mouth, the teeth, the gums. And then we go on to the next section, which is the diaphragm to shoulder line. And so again, in here, we've got the thyroid. And then we move along, and we've got the lungs. And then we get to the shoulder at the very side. And then we go across from zone 1 out to zone 5 and just flush all that through to the armpit. And then we finger walk at the front of the foot. And this is the chest and breast. And we finger walk up, and then we thumb walk up, and then we finger walk up. So we're moving all the way up to the top of the heart. And then our next section is the waistline to the diaphragm line. And so we're going to thumb walk starting at zone 1. And this is the tummy, the solar plexus, and on this side we've got the gallbladder and the spleen. And so again, we're just rebalancing, allowing any overproduction, overstimulation of chemicals that are just sitting there not really doing us any good to flush out and get rid of it. Going over the spleen and the gallbladder, I'm just giving those a little bit of a rinse. And now we go from the pelvis line up to the waistline. And so again in here, think about what we've got in our actual body, because the reflex points are following along with that. So it's the colon, large intestine, small intestine. then we come down on our last section, which is the heel to the pelvis line, and this is for sciatica, hip and pelvis issues. And then we come down the spinal channel all the way down. And then all the way back up again. And then we work on the outside of that foot, which is the shoulder, waist, hips. The hips crunchy this side as well, all the way down. And we go on to the kidney and bladder. So the bladder's always shows as a bit of a sort of raised area around here. If we work backwards for you to find it, we've then got the urethra that comes here, and then we've got the kidney about here. So it's always, we've got the solar plexus here, and the kidney's normally just a little bit below the solar plexus. And so we're just circling on it to bring it back into balance. Help it flush. Rinse out any of those toxins. And then we're going to just transfer those toxins through the pipes that go from the kidney to the bladder. And then we massage on that bladder point really gently. And then we move on to the ovaries, the womb, and the fallopian tubes. Unless you're on a man, working on a man, then it's the vas deferens and prostate. So we go here first, and this is the womb. So often it's where you can see the hard skin finishes and the sort of softer live skin begins. It's just at that point that the womb is. And sometimes if someone's had a hysterectomy, it sort of feels like there's a hollowing, a scooping out where it's no longer there. It's quite fascinating. And sometimes if they're pregnant, you can feel an extra little lump, which is the baby growing in the womb. And then we're going to come to the same spot but on the outside of the foot, and this is the ovary. I think the mistake that a lot of people make with reflexology is just going straight for those points if they have trouble with their periods. But if you remember, the very starting point on the big toe is that pituitary, and that's the motherboard of all the hormonal computer system of the body. So we need to make sure all of them are balancing. It's like a game of mousetrap. Something has to trigger something that then lets something else happen. So there's no point going straight to the root, the cause. We need to go straight to the root of it and start balancing. And that's where I think reflexology is such a powerful tool, because we work on the whole endocrine system, which is the whole hormonal system of the body. So we've done both feet now. So the last thing we're going to do is the colon, which I really enjoy doing. So the colon, if you can just put both of your feet together for me, thank you. So the colon, I need to move my camera a smidge, starts, it wraps around both of the bladder points. So remember, the bladder point are these sort of pads here. The colon comes up this foot, across the top of the bladder point, round, down and out. And if you were to look at the body, the tummy, and if you remember baby massage, if you ever did that on your little ones, we go up, across, down on the tummy. And so that's what we're mimicking now to help with that. So we're going to come thumb walk up this side, across the top. And we're going to come to the other side, across the top, back down and out. We're going to repeat it a couple of times. So that we've given it a nice, thorough chance to rest and digest. That's the next thing that I want to really concentrate on with breath work and techniques, because I think if we are not in our rest position, we can't digest well. And so again, with reflexology working as it does, we've really worked on soothing, calming and rebalancing all of those systems. So to now, once they're relaxed, the colon will relax and let go, so we can really help to release. And then the last thing I like to do is work along the diaphragm line, so that we're helping expand the breath and giving the body a big chance to absorb as much oxygen and really thoroughly breathe in and then let go. And then we twist. And if you think of, if you're sitting upright with your legs out in front of you and you twist one way and twist the other, and you're sort of rinsing, wringing out your tummy and your intestines and your liver and kidney, and this is the equivalent of us doing that on all of those organs within the reflexology, giving a nice twist and rinse. And then we very slowly slide ourselves off and away